They are the very backbone of our free enterprise system, and today on this program you will meet the individuals behind one such organization. I'll be back later in the program to introduce the Keeping America Strong Award. And now, let's learn more about the organization we are honoring today.
Today, the eyes and ears of the 21st century are focused on new developments, new technologies, new emerging companies. We're on the scene to bring it to you as it happens.
We anchor from our new studios in Los Angeles and then go out all over America to get to the heart of the story.
I'm Bert Tenzer.
I'm Bella Shaw.
I'm Doug Llewellyn.
And I'm William Shatner, and this is Heartbeat of America. Since 2001, our television series has been featuring entrepreneurial companies that move our country and our economy forward. Standing by at our studios in Los Angeles is one such company. Welcome. Good to have you with us. All right, let's begin by telling me what you do and who benefits from it.
Heritage Eye Associates is a medical practice that specializes in eye care. The practice has been around since about 1910, and I've been the medical director and the primary physician for about 25 years now. We take care of all ages of patients, from youngsters to seniors, and we provide the gamut of eye care services from simple things like glasses to the most sophisticated technologies in eye surgery and intraocular lenses and LASIK.
Well, you're obviously successful, so what do you attribute your success to? Any particular philosophies or strategies?
My primary philosophy in practice is the golden rule. I like to try and treat patients as I expect they want to be treated and as I would want to be treated myself as a patient. And that carries over into making sure that I'm the patient's advocate in the complicated medical environment we have these days, as well as making sure we give the highest quality of care with the best technology under the best of circumstances and with the greatest staff that we can provide for them.
Now, stay with us. There's more to come.
Thank you very much, William. Now, I'm Doug Llewellyn here in our studios in Los Angeles with our guest, who is the medical director of Heritage Eye Associates in Stockton, California. His name is Dr. Kenneth Miselis. And I would like to point this out to you. This is a very handsome award. He has been given by the Consumers Research Council of America that names him one of America's top ophthalmologists in the year of 2008. He's very proud of this, and indeed he should be. You've already seen him, so let's formally meet him again. Doctor, welcome. Nice to have you with us.
Thank you. Nice to be
Let
here.
me ask you you gave a very good explanation to Mr. Shatner about your practice. Let's go into it a little bit more detail, because it
Sure.
really is very complete. And I think the thing that amazed most people, you said this began back in 1910, this organization?
The original practice was started by a pair of brothers back in the early 1900s.
Yeah.
And the second brother's son continued on with the practice up until 1983, which is when I came and joined the practice. He subsequently retired about 6 months following that, and I've been the medical director since 1983.
I would imagine there aren't many practices that have this kind of history behind it.
No, it's quite
Would you agree with that?
It's quite a nice heritage for Heritage Eye.
And you really you give complete eye care.
Absolutely.
Really, everything associated with eye care, from what I can read, you cover. What essentially, really, what are all the services you offer?
Well, we start with the basic sort of examinations that are general medical examination of the eye and examination for glasses or contact lenses, just fitting people with their normal eyewear that you would get commonly.
Right.
And then we spend a lot of effort on making sure that we understand the structure of their eyes and what we can predict for the future of their eyesight, if there's anything that might threaten that eyesight, the potential for other disease processes. Make sure that we screen them for glaucoma or other eye diseases that may be hereditary in nature. Analyze them if they have other coexistent diseases like diabetes, and as they age, to look for the other age-related typical changes in an eye, such as cataract formation or the potential for macular degeneration.
But you handle all those problems. You do LASIK surgery as well.
That's correct.
You also have a skin care department in your facility?
Right. Over the course of the evolution of the practice since I've been there for 25 years, we've found that it's a convenience for patients to have a variety of services available right there. So we've expanded the original optical boutique to include designer frames and fashion eyewear, because that's what people want nowadays. And we've also added an in-office excimer laser to provide LASIK surgery without patients having to go out of town, which they had to do originally. And now we can control that product quality in our own facility. The skin care side of things is kind of odd, because the way that originated was more people after their modern cataract surgery and after LASIK surgery stopped wearing their glasses, and they started noticing the wrinkles on their faces or the parts of the look of their face that they didn't like in the mirror, frequently kind of wanting to say, how did you give me wrinkles after my cataract surgery? And so we added the skin care stuff so that we could address some of those issues with patients while they were there and while they were concerned about it.
I know one of the other things that you really do focus on heavily is kind of the family doctor atmosphere in your practice, which is not present in a lot of practices like this. Right?
Yes. Unfortunately, a lot of medical care these days is a mill-type environment where patients feel like they're on an assembly line, and they're really treated like units rather than persons. And I don't like that myself. And I don't like to be treated like that. The cattle car approach to anything, and certainly in medical care, patients are uneasy with medical care in general. They're nervous. They need to feel welcome and comfortable. And the family doctor tradition that the practice that I joined carried from the early 1900s, that we've tried to foster. It's been difficult to do because there's a lot of pressures for cutting time with patients to decrease costs, etc. And as a consequence of that, it's been difficult to maintain that family doctor relationship with patients. But I think we've really tried to continue that.
Do you have a lot of doctors who are there with you, or are you the only one? What's it set up?
I'm the only ophthalmologist in the practice. We have 2 optometrists that work with us currently, and we have 3 opticians.
All right, so to begin, the first step obviously is the exam. Have things changed in the exams? I mean, it's gotten much more technical in what you can do now and what you can learn, hasn't it?
Yes. Yeah, the standard eye exam part, measuring you for glasses, is pretty much the same, although there's a lot of automation in certain practices. I don't like automation because it puts the burden of interpreting the information on the machine rather than the doctor, and I think that's the doctor's role in things. So all our patients see a doctor. That's number one. They're not measured by technicians and prescribed glasses by technicians, which is common, unfortunately, these days. It's an efficiency kind of thing, but it's not, in my mind, the appropriate way to take care of patients. So all our patients are seen by a doctor. They're measured, on the automated equipment, but that's backed up with an individual assessment of them. Our optometrists take care of the routine care of the patients in that regard, and then the patients are sent to me so that I can evaluate them from a medical perspective.
It seems to me, though, the last time I had an eye exam, for example, the doctor took a picture of the back of my eye, and they keep that in frame, and they compare it the next time, a year later when I go back.
Absolutely.
They will, right? That's something relatively new, isn't it?
Yeah, there's a lot of new technologies in that regard. There are different ways of managing just the routine kind of screening thing so that we can see what you looked like last year, as you said, and then we can make sure that nothing has changed, which gives us an indication of what the future holds for your eyes. And we use that technology frequently in management of diseases. For example, it's a very common thing to assess macular degeneration.
Kind of vitamins, especially lutein, and they talk about vitamin C and some of the other vitamins that are mixed. And there are pills that are you can buy in the drugstore. Does that help, Dennis? Does that help delay the onset of macular degeneration?
The answer is we don't really know.